In-Person Sitter Op-Ed by Claire Betch. When a patient in the hospital is at risk of falling, has dementia, is at risk of suicide, or has other issues requiring close supervision, the hospital might implement a sitter to be always in their room. As a person who works directly with patients and sometimes must be a sitter in an at-risk patient's room, the in-person sitters provide better care for the patients. Patients deserve our best care, and a computerized sitter is not always enough. The hospital can be very lonely, so sometimes the patients like having someone to talk to about their worries or even their families. Allowing the patients to talk about what is on their minds can make them more at ease and willing to go along with the treatment plan. In Rebecca Johnson's article, What is a Hospital Sitter? Everything You Need to Know, she describes the role of the hospital sitter position and the tasks they do for the patient. One of these tasks is providing patients comfort by keeping them company in their rooms. Older patients, whom I find to be the primary recipient of sitters, might find conversing with or even just having the computerized sitter in their room frightening, which can make them uncomfortable in their hospital room. Computers cannot perform all of the tasks required for the patients, such as baths, helping in the restroom, or any other hands-on activity. In the journal article, The Cost Effectiveness of a Patient Sitter Program in an Acute Care Hospital, a test of the impact of sitters on the incidence of falls and patient satisfaction, the effectiveness of sitters versus their computerized counterparts are discussed. It found that having the patient sitters in the hospital rooms decreased the likelihood of falls and increased the satisfaction of the patients. One hospital in South Carolina found remarkable success in their computerized sitters, which is talked about in the video from South Carolina ETV called South Carolina Hospital Uses Innovative System to Keep Patients Safe. They talk about how they did not have the proper workforce for one-on-one care for every patient. This hospital found immense success with its new system. Although this hospital was able to find success with the computerized system, it does not mean that this is the overall best choice. The camera operator calls in a staff member whenever the patient needs something, so a person must do everything for the patient anyway. In the article, The Cost Effectiveness of a Patient Sitter Program in an Acute Care Hospital, a test of effective sitters and the incidence of falls and patient satisfaction, the cost effectiveness of the sitters are reviewed. The authors a study conducted a study and determined that although it costs more money to supply the patients with an individual in-person sitter, the work that the in-person sitters can do makes them better for the patients than computerized sitters. In conclusion, when a patient in the hospital needs extra supervision for one reason or another, the hospital might implement a sitter to be always in their room. As a reader, you can make suggestions in your hospitals to have more in-person sitters available and to start a class for it at the hospital. If a relative or someone you care about has a computerized sitter, you can request that they get an in-person one instead. And if they have an in-person sitter, you can thank them for what they do. If we begin to rely on computerized sitters, response times to patients will be longer, and it could have a terrible result in an emergency situation.